Alan. My name is Ida and I am assigned to examine you today. I am a nurse practitioner student of United States University, and I'm going to ask permission from you if it's okay for me to videotape this interview.
Yeah.
Would you mind if I'll sit down? And
Sure.
also, I just want to let you know that I'm going to take down some notes to make sure that I have accurate information. So what brings you here today?
It's a wellness checkup.
When was the last time that you had a wellness checkup?
Like a year ago.
How old are you?
I'm 54 years old.
What is your occupation?
I graduated from Bachelor of Science in Civil Engineering, but right now I'm helping the household chores.
So meaning are you
Stay home dad.
okay? What a hard job do you have?
Thank you.
What's your height?
5 feet and 6 inches.
What's your current weight?
210 pounds.
Any medical issues that you have?
I have the hypertension. I have asthma, cervical stenosis, and my cholesterol is higher than normal,
Okay,
and I have asthma.
all right. Any hospitalizations that you have been through?
I have like a gallstone removed, just like outpatient. Not outpatient. Yeah, I have my gallstone removed.
So were you admitted in a hospital during
Yes.
that time? Okay. And any other times?
Oh, I have like a debated septum reconstruction.
I see. So just to clarify, you've been admitted to the hospital when you had your gallbladder removed,
Mm-hmm.
and then you had another surgery, which is repair of your nasal septum.
Mm-hmm.
All right. Are you updated with your scheduled immunizations?
I'm not sure when I was in my childhood. I don't know if I'm updated, but I'm okay.
All right. So what about the pneumonia vaccine?
Within 5 years, yeah, I have the immunization for pneumonia
How about your flu vaccine?
yearly.
You got yearly. So when was the last time you had one?
Last September or August of 2018.
Okay. How about the tetanus shot?
Oh yeah, lately, like spring break, I have like a tetanus shot lately.
Okay. Do you have any allergies?
Yeah, seasonal.
Oh, so you have, what do you mean by seasonal
Like
allergies?
environmental during springtime, I'm allergic to molds, weeds, pollen,
Okay.
and I'm allergic to like colds probably.
So, what about any allergies to medications?
Nothing I know of, but I'm allergic to latex and the soy milk for food.
Okay. Any other food allergies aside from the soy milk?
Nothing I know of yet.
So, what was your reaction when you drink soy milk?
I have a puppy eyes, it's like closing my eyes. It's like bulging.
Okay. Any respiratory problems when you had your allergy reactions?
For the soy milk.
Yes.
Not that severe because probably I feel like there's like burning sensation in my throat.
Okay.
So, but I took right away. I have like a Certic that time, or so I took the medicine right away.
and the medication helps it.
Yeah.
What's your reaction with latex?
I have some rashes on contact with latex, like bandages or
Okay.
tapes that they base on latex. So I have a rash on contact.
Okay.
And if I inhale the powdered product of latex, it aggravates my asthma.
So you have to make sure that when you have visits in the doctor's clinic or when you are in the hospital, you need to make sure that you let them know that you are allergic to latex.
I do.
Okay.
Yeah.
How about reactions to your environmental, like the weeds?
If I don't take my allergy medicine, yeah, I have like shortness of breath if there is a high pollen content in the air,
Okay.
and like weeds or molds. So I make sure the daily reports regarding with the allergens in the atmosphere.
So how do you prevent from having these allergic reactions?
Staying away from the contributory, like I don't go outside if it's high season. I don't open the windows, doors of our house, and keep it cleaning up in the house so that there's no molds or weeds inside our pollen.
Have you seen a specialist in allergies before?
Yeah, I did. So they took like I undergo the immunotherapy for allergies like weeds, anything that I was tested positive for the allergens.
So when was the last time that you remember you had a reaction?
Not for what is your question for the?
For the weeds, the pollens.
Actually, not because I regularly taken my prescribed medicine. So I when I cut the grass or weeds, use the mask, and I took my allergy medicine before doing outdoors chore.
Okay. So that is very helpful when
Yeah,
you
it
when
helps rather
okay.
than not taking and doing house outdoor job. It aggravates my asthma. So
Okay, so when was the last time that you had an asthma attack?
nothing I know of yet because if there is like a small symptoms that I know of, I like took away my I took right away my medicine. So I took my medicine right away so that I don't have like really an attack of an asthma. You know what I mean? Just like my asthma is controlled.
I see. All right. So what medications do you take? Do you take
I
prescription medications as you mentioned earlier?
Yeah, albuterol. Before I took like a Singulair, but I don't take it anymore. I just like albuterol and then Zyrtec. And sometimes if the really severe, I took like Flonase nasal spray. And if my asthma is really bad, I had a prescription of like Advair. But right now it's been years already. I'm not using that, so it's
So
well controlled.
so what do you mean that it's been years you're not using
The Advair
the Advair? Okay.
because I don't have like really. I know already the symptoms, the signs and symptoms of having an asthma. So prior to to aggravate my asthma, I already took precautionary prescription already. When worse, before things get worse.
So what other medications do you take aside from albuterol, from your Zyrtec, because you mentioned you have hypertension. Are you taking any prescription drugs for that?
I'm taking amlodipine, a low dose, 5 milligrams in the morning, and atenolol.
Okay, so
And my blood pressure is well controlled. I check it every day, or actually before I check it every day, but not anymore because my blood pressure is well controlled.
what is the dose of your atenolol?
Like 10 milligrams.
10 milligrams, and you take it also once a day?
Mm-hmm.
How about for your, you mentioned about high cholesterol. Are you taking anything for your
Yeah.
cholesterol?
I'm taking atorvastatin, 40 milligrams every day, and my blood work shows that my cholesterol level is normal now, and my blood pressure is normal. Everything is controlled.
So everything is controlled. So I just want to go through and review your medications. So you're taking atorvastatin, 40
Mhm.
milligrams once a day, which is for your cholesterol. You're taking atenolol 10 milligrams daily,
Mhm.
and amlodipine 5 milligrams daily for your elevated blood pressure. And you said you don't take the Advair anymore.
Mhm.
So you take Flonase nasal spray as needed.
Mhm. Yeah.
So how often do you use this?
During the season where the pollen and molds is high, during especially springtime,
Okay. How about Zyrtec? You said you take this daily.
daily, yeah.
Okay. And how about your albuterol? How often do you take that?
Just as needed, but during high season it's like twice a day. But right now it's not like, it's okay because it's not that much.
So
Oh,
you're
yeah.
taking this as needed as well.
Yeah.
Any other medications like supplements, vitamins,
Oh, yeah.
over-the-counter medications?
I'm taking vitamin C, Super B complex. I'm taking Super B complex. I'm taking vitamin D.
And you take that every day.
Yeah, I'm taking that every day.
So let's go to your family history. Is there any medical history or family medical issues that you can tell me about your mother?
My mother, she had cancer. She died early at 35 years old. She had a lymphoma,
Okay.
and she's a smoker. And my dad died when like 55 or 60 years old with the cardiac arrest. He has like high blood pressure.
How about your grandparents?
My grandma died with a stroke, and my grandpa died with a stroke too.
Okay. So
And
you
both my grandparents from my mom and my dad's sides.
so you have a very high family history of stroke.
Yeah.
How about siblings? How many siblings do you have?
I have 7 siblings, and they are like having hypertension, and my sister died with breast cancer and diabetic.
So how old is your sister that died?
50 years old
And she's the one who has breast cancer and
and
diabetes.
diabetes.
Any other siblings that has some medical issues?
Just like another sister like hypertension, and my brother. That's
And you
it.
have one brother, so
Yeah,
you have 2 siblings that have hypertension, and the other one has breast cancer and diabetes. Do you smoke?
No, I don't smoke.
But you never smoked in your lifetime.
No, never.
Do you drink alcoholic drinks?
Occasionally,
What do you mean by occasionally?
when there is say like I was invited in a party, just like a bottle of beer is okay with me, but I'm not like a heavy drinker.
So when was the last time that you had an alcoholic drink?
Just one bottle like a month ago.
Okay. And what kind of alcohol do you drink again?
Beer, anything that is available in the party. I can drink a shot of vodka or tequila, but it's not that like I'm a heavy drinker.
So you're not a heavy drinker.
Yeah,
Have you used illicit drugs before?
never.
How about caffeine?
I took 2 cups of coffee every day.
So 2 cups of coffee every day. Do you exercise at all?
Sometimes
So what kind of exercise do you do?
walking,
And how often do you do that?
not really often, like or twice a week.
So you do that 2 times per week. Do you eat a balanced diet? Like having-
Not really, occasionally too.
So do you have portions of vegetables in your
I do, just like 3 times a week.
how about fruits?
Yeah, every day.
How many glasses of water you drink every day?
Probably approximately 4 to 6 or 6 to 8 glasses of water.
What is your religious affiliation?
Roman Catholic.
So when was the last time that you had a blood works done?
Like 3 months ago.
3 months ago. Are you aware of what are the blood works and what are the results?
Yeah, after taking the blood works, I set an appointment for my doctor to have me, explain the results. So everything is normal except like my liver enzyme is high.
Do you have a history of liver problems?
No,
Are you in any pain?
yeah, occasionally because I have cervical stenosis.
So how often do you experience pain?
Actually, I'm not sure because sometimes it's not like annoying. Sometimes I don't know if it is when you say pain to me it's like it really hurts, but I can tolerate it. But it's not that often.
So what triggers that pain?
When I get up or like do quicker movements or like I different position or something like or getting up from bed or getting up from the floor standing my knees hurt or like my shoulder or something.
Have you been diagnosed to have arthritis?
No,
No?
just only cervical stenosis.
So what relieves your pain?
Over the counter prescription like ibuprofen. That's my doctor recommended me.
So how often do you take the ibuprofen?
When pain is really, I'm really in pain. I took like every day for a week, like 400 milligrams in the morning, 400 milligrams in the evening. Then I stop it, not in order for me not to be dependent on the pain medication.
So when you take ibuprofen, just make sure that you take it with food.
I do.
and not take it on an empty stomach because it could increase the risk of bleeding.
Mm-hmm.
And what other things that you do to help with your pain aside from ibuprofen?
Like a warm shower, so keep my blood circulate, or just like walk, or like
Do you do some stretching?
a little bit.
Have you had this checked by a pain specialist?
No.
No. Have you mentioned this to your doctor before?
Yeah.
Have you been to therapy for your pain?
No.
No. So does the pain affects your daily normal activities?
Yes, it did.
So how did it affect?
It's not my usual pace. I move faster. So like, let's say 100%, my movement now is like 10% of my 100%. It's like that because of the pain. When I bend, turn, I make sure I don't snap my bone or something. Or like when I'm driving, looking left and right, it hurts my neck.
So does the pain radiates anywhere?
In my shoulder, in my knee.
Okay.
Yes.
So mostly, as I'm just reviewing your pain, it's mostly on your joints
Mm-hmm.
and aside
Yes.
from your neck. Okay. So how will you rate your pain, the worst pain that you have experienced with a scale of 0 to 10? 0 being no pain and 10 being the worst.
Sometimes I feel it's like 7. It's just like tolerable to me. It's not really in pain. To me, 7 is okay.
7 is still okay with you. And does ibuprofen offer relief for your pain?
Yes, it is.
Okay. So, when were you diagnosed with hypertension?
I think when I was like 35 or 40 years old.
So, you have mentioned that you checked your blood pressure before, but
Yeah.
then now, because it seems to be normal, you haven't checked it.
Yes.
So just make sure you continue to check your blood pressure to just have a spot check that it still continue to be okay. So
I go to my doctor regularly, and they check every time my blood pressure to it's normal.
So are you aware that because of your high blood pressure and then you have high cholesterol, you are at risk for cardiovascular events such as stroke. So you have to make sure that you take your medication regularly, you do your exercise, and follow up with with your doctor regularly.
Yeah, and I watch the food I eat too.
Have you been tested for AIDS
No,
or sexually transmitted diseases?
no.
So how long you had your asthma?
Not sure. Probably I have an asthma since childhood, but undiagnosed.
Okay. Do you have a history of asthma in your family?
Yeah, my great grandparents or something like my family, my cousins. Yeah.
So there's
And
several family members who have asthma. Do you have any questions for me at this time?
so far no, thank you.
So let's continue with the, I have to check your different body systems. So do you have any rashes, any redness on your skin,
No,
any wounds?
no, nothing.
How about I see you're wearing eyeglasses. Do you have problems with your vision?
Yeah, you know, age probably, that counts my, I, you know,
Are
probably
you nearsighted or farsighted?
nearsighted, probably
So do you have your vision checked regularly?
yearly.
You hear me very well.
I do, yes.
Any problems with your smell?
No, not at all.
When was the last time that you had seen the dentist?
Just like 2 weeks ago.
Any issues with your teeth?
Nothing. Just like cleaning up,
Okay.
regular clean.
Any problems with your sinuses?
Nothing now.
So, aside from the occasional neck pain, do you have any swelling that you have felt on your neck?
No, nothing. No swelling in my joints, no. Just pain.
Pain occasionally.
hmm
Any coughing at this time?
No, not at all.
Any shortness of breathing
No,
while at rest or while having exercise or walking?
no.
When do you remember if you had an x-ray done?
Long time ago.
Yeah.
Like 3 years ago, probably because I complained with my pain. They don't see anything about in the X-ray. They thought like I have arthritis, but there's none.
No, but how about chest x-ray?
I it's normal, but that was a long time ago, probably 10, 15 years ago.
Okay. So, have you been experiencing chest pain?
No,
How about palpitations?
no,
Have you had any, we call it ECG?
yeah, like a year ago.
Was,
Everything is normal. Like I have a stress test. It's normal.
so you had a stress test and that was normal. When was that?
A year ago too.
So a year ago. How's your appetite?
Normal.
So you eat okay, there's no problems.
No problem.
How about your bowel movement?
Normal.
So you have a normal appetite, normal bowel movement. How about any abdominal pain?
No, not really.
Any nausea or vomiting that you had experienced?
No.
So I know you mentioned that you have liver problems. Have you had a colonoscopy
Oh,
or?
just lately, yes. Like 3 weeks ago or a month ago, I had a colonoscopy.
And what was the result of that?
I have like 2 nodules, but it's not it's just a benign. And I was told to come back after 5 years
Okay.
for another checkup.
Any blood in your stools?
No,
How about any blood in your urine?
not at all.
So you are able to control your urine very well?
Yes, I do.
Okay. So with your legs, you said you're having sometimes pain in your joints.
Yeah, it's
Your
only my
knees.
left knee, not both knees.
But any pain on your legs, like,
No, not at all.
and you said neck pain, joint pain, how about back pain?
Yeah, there's like probably that's part of it. I can't describe it well because it seems like it's not really specific where is the spot. Probably in my spinal cord or column or something. or cervical column. It's not really pain or something, just like annoying. You know, when if I describe pain, it's like it's like hard in the same spot, but it's not that like a blow or something. Pain now.
But you have done testing for that.
Yeah.
What kind of test did they do?
Oh, I have EKG. What do you call that? MRI?
MRI.
Yeah, I had an MRI.
Of your back.
Yeah.
And what did?
That's why they got the spinal stenosis.
So they have that spinal stenosis.
Cervical, I mean.
Okay. And nothing
Diagnosis.
they're doing further to help you with the pain.
Just taking ibuprofen, but I was told by neurologist like, only there's no cure for that unless it is done by surgery.
Okay. And you don't plan to have a surgery?
Not at all. For now, I still can handle it.
Okay. So any history of depression?
Oh, lately I forgot to mention that. Did I? I forgot. Yeah, I have like a minor depression, and my doctor prescribed me Buspirone,
Okay.
like 5 milligrams twice a day.
Okay.
And
When did you get diagnosed?
lately, like a month ago.
A month ago. And you've been taking this medication since then?
Yes,
Does it? You feel like it's helping you?
I think so. Yes, I'm not that sensitive anymore.
Okay. Any anxiety?
Not really, not at all.
Okay. All right. So, any problems with your memory?
Probably it's just normal to live. Sometimes you forget something. Not really, not that worst.
Okay. Any seizure history?
No,
Any fainting?
not at all.
And you know indications of bleeding that you
Concerned of? No.
concern of? Any symptoms of diabetes?
Borderline.
What do you mean borderline?
My blood work shows like I'm like a point to the diabetic zone, to the
So,
normal level.
but you haven't started anything.
Actually, because it's been like a while that I am in a borderline, so I am the one who asked my doctor to if she prescribed me metformin, but it doesn't help though. It's still the same, but my doctor said just stop it rather than because of the complications.
So, when was this?
It's a long time ago, a year ago.
So, a year ago. Okay. So, anything else that concerns you today?
Actually, not at all. I just like want to make sure every year I should have like a wellness checkup.
Okay then.
So that's it. Like,
All right. So we'll follow up with some blood work so we can check and follow through to make sure that your cholesterol, your blood sugar, if you said you are borderline. So that concludes our interview right now. Thank you so much.
thank you too.